got some really good things to share with you. So just a reminder about who we are. This is who we are. Georgie's in the room with me, so you can see we've got a slightly strange wide angle camera. That's me and Georgie on one. Alison is there as well as Nick. Our agenda is looking like this. So we're going to start off by looking at Start for Life, which Alison will explain to us, and Georgie will then do a Send Us update. At that point, as Tracy suggested, we'll pause the recording and then we can break for questions at that point, particularly on the basis of those two presentations. Then we'll come back to the to presenting with Nick talking about our inclusion project in schools, Alison talking about short breaks, and I'll talk about the SEND strategy refresh. And again, then there will be opportunities for questions. And I'll just say to colleagues who are presenting, we've got our time scales. So, and I know that questions are always really, really helpful. So we'll work briskly but appropriately through our slides. Okay, so Alison, I'm going to hand over to you in terms of Start for Life partnership.
Okay, hi, I'm Alison, for those who may not know you, and I work in early years, early help and family wellbeing, which includes our short break service. We've been successful in central government funding for what's called a transformational programme across family hubs, which incorporates a programme called Start for Life. I think you go to the next slide. Am I doing slides?
I'm doing slides, Alison.
Okay. So within our Family Hub funding, we are required to publish what's called a Start for Life offer. Now, our Start for Life offer is very specific from conception up until the child is 2, so working with families from conception to the age of 2, and really working towards the development of a publication of our offer, our pathways, how support works, differentiation between our universal services and then moving towards targeted services. So what you'll be able to see here is from the report were 6 action areas of which we're being asked to consider as we start to think about the publication of our services for our most for our families with the most youngest children. So if we go to the next slide, please. So Start for Life offer is a national initiative, and there are about 87 local authorities that have been funded to work across the Family Hub agenda and incorporate their Start for Life offer within that. I mean, obviously all of this is relevant for all parents, but they've identified 6 particular areas where we should publish information about pathways of support and then identify gaps. And obviously you can see at the very bottom of this list that are very particular for new parents is the offer around SEND support. So really what I thought today, it is quite a detailed framework. We're at the very beginning of our journey. We will want to work with Kids First. We've just set up our Start for Life partnership, and I'm not sure if an invitation has come to Kids First yet. So hopefully from this presentation today, we'll be able to make those links and get you, if you would like to be involved in our Start for Life partnership, which is a requirement for us to establish a Start for Life partnership, and also a parent carer panel for parents with children between the ages of 0 to 2 to really steer and help us co-produce our offer. We've got the next slide, Elizabeth. So what you'll see, the main deliverables for our Start to Life programme is to design, deliver and publish our Start for Life offer, work with very, very closely with communities and establish our parent carer forum. And then we need to deliver across those 6 minimum service areas. And we have a framework for us to do that. Now, this is quite detailed, so I'm not going to go into detail around this, but if anyone would like to come and find out a little bit more, then we could have a separate meeting around Start for Life and/or come and join our partnership. But there will be task and finish groups that will come out of our work, and there will be a focus around that SEND component within the publication and the work we're doing around our offer. Can you go to the next slide, Elizabeth? This is just further reading. So when we share the slides, if anybody's particularly interested, there's some links there. And then if anybody from Kids First would like to join the partnership, I've just put our strategic lead for Start for Life is Sanjana Geo, and she can be contacted at that email address. Just quickly wanted to show you a little bit more detail around Start for Life and the kind of work we'll be doing. So can we just go to the next slide, Elizabeth? But I don't think it is the next slide because this is the detail for midwifery. Can we go to the next slide? health visiting. Next one. I think it's the last one of these. Next one. That should be breastfeeding, and then the next one, send. So what you will start to see here, and it is quite detailed, so I do apologise. So this is taken from the framework that we're working towards at the moment. And what you can see here is across the very top that we've got services, our minimum offer that should be available face-to-face in our family hubs. And then we've got another column, which is service available through the family hub, but it might be received elsewhere. So that's where you might go in, find some information, and then there'll be a brokerage service. And then our virtual offer, which will be very much around incorporating some of the information on our local offer, but having a very specific pathway and information hub, I guess, for Start for Life. And one component of that will be around support for families where there's children with special educational needs and disabilities. And that's still in that very, very early years phase. So I just wanted to kind of share this with you. And if you want us to come back and do updates, we're very early in our journey at the moment. But what you'll start to see is a minimum expectation that we would be delivering from our family hubs in those 3 categories. And as we start to develop our programme, you can see our go further. We're not at the go further stage at the moment, and we're just mapping our services across all of these minimum standards. So that's really what I wanted to share today, that piece of work that's taking place. We intend to publish the offer by October. So it's quite a tight timescale, but the work that will continue around service development, promotion, and the embedding of services in family hubs will take much longer and will continue past October. So I think that's possibly all I wanted to say today. There is the next few slides are very specific to family hubs, so I think that might be too much information today, but there is another slide which will show a geographical location of where our main family hubs will be. So where you looked at those minimum standards within a family hub, so 1A and 1B, which is Church Children's Centre and Phipps Bridge Youth Centre, and 2A and 2B, which is the Acacia site, will be our 2 main family hubs. And then we will have satellite sites, and that will include our libraries as well. So really that's for the family hub. So I just wanted to touch today on the Start for Life offer, which was the first set of slides, very specific to children and families from pregnancy up until the age of 2. So I think that's it for me. Now I have to leave this meeting, sorry, but I will come back in for the short break. So I don't know if we want to take any questions now, if that's okay, or did you want to take the questions after Georgie, Elizabeth, and then I can just pick up any email questions or anything like that?
And maybe Alison, I was just going to think that when you come back in, if there are some questions raised which I am unable to answer, then maybe I can take those too. But this was the final slide, I think, which is a summary really of the family hub work. Yes. Yeah.
Well, this is the high action impact areas that were identified within the Start for Life review, where they pulled together quite a large national wide review around what best practice would look like when we're starting to look at support for children from conception up until the age of 2. So these were the recommendations that came from that report, and then within that they identified the 6 action areas. So this is very specific to our Start for Life work, this last slide.
Thanks, Alison. See you later.
Okay, thank you. Bye-bye.
And I know that we're now going to Georgie.
Good morning, everybody. It's lovely to see you all again. So I have these SENDIS updates for this term, and really they're around 2 key areas. And the main key areas really is what's been happening within the service and how the service is developing, and also around our annual review and improvement plan going forward around annual reviews and our statutory work. So I think the update is that we were looking to ensure caseloads were reduced from our SEND case officers' point of view to allow us to complete the statutory work that we're required to do in the timescales, and also to a higher quality, ensuring that we're putting the children and our families at the heart of what we're doing. And we have done that. We've had additional staffing budgets that have been secured. We actually got additionally 8 EHCP coordinators, which have been imposed, although there is a change happening at the moment because we have had some staff leave this term. So we are looking to recruit at this point in time. So there may be a slight change to your coordinator at the moment, but bear with us. We are in the process of securing coordinators moving forward. But it does mean that we have reduced caseloads down now from what was around 270, 300 families per case officer to 150. So we are seeing that this is making a significant impact as we go forward in the work that we're doing. We've reconfigured the teams, so the teams now are in 4 teams. So we have our EHCNA, and I have to practice that one, assessment team, which do our assessments and manage the early years teams, currently the children under the age of 5 in our early years. We have our primary team, we have our secondary team, and our post-16. This really has worked very well going forward. We have the expertise in the team of those areas now, which helps us develop the service going forward. But it also means that with those decreased caseloads and one phased transfer in each of those teams, whether that be reception, phase transfer, secondary, or post-16, it allows us to really focus on the work that needs to be completed. And it also means that we've built capacity within the post-16 team to plan for that preparation for adulthood. We know that's a really sort of important phase and stage. And what we want to do is give the time to those young adults to be able to give them the opportunities to really develop those plans in a cohesive and joined up way with our colleagues, both in health and social care. We've clarified expectations for our EHCP coordinators in relation to attendance of annual reviews. And annual reviews, as I say, is a key piece of work moving forward for our next academic year. But also looking at giving importance to working with our children looked after and those also that require PEPs and other plans, social care plans, and looking at how we can really pull together all of that documentation, those meetings, joint meetings where we're ensuring that we're not over looking at our children, over assessing and working together really to bring that in the EHCP with those outline provisions required. So this is an ongoing piece of work that we're doing and developing as we go into next year. So we're also looking at the EHCP review schedule to all educational settings, informing them of when the annual review should take place. So this again is a really important piece of work about making sure that we're within our statutory timescales to be able to develop our plans moving forward, to look at the quality of our plans. We're looking at making sure that our case officers know that the annual reviews are taking place, because we want to proactively be part of those annual reviews and ensuring that we're getting more of a engagement in those annual reviews from the wider network as well, because this allows us to make those annual reviews a really important meeting, looking at the outcomes for our young people, reviewing those outcomes and thinking about our next steps. So the annual reviews are an ongoing programme within SENDIS that we will continue to work on, and there'll be more information as we go forward. Because from that, we're looking at how we can improve our annual reviews. So we are reviewing the annual review template currently, and we are issuing new paperwork, and we hope this will be through and out to schools and parents for September 23. But we're also within that issuing guidance and annual review advice to head teachers, SENCOs, SEN leads about what an annual review is, what the local authority expects of an annual review, and how we can work with our schools, with our education providers, and with our parents to make sure that the annual review is a really worthwhile process, because we don't just want it to be something that we do as part of the system. It's a really important step within our young people's progress. And then what we're also developing is an easy read guidance to develop an information for parents, carers and young people about annual reviews and what should happen at these meetings. So this guidance is in draft currently, and it will be with the Kids First Working Group for consultation. But again, this is about engaging our young people and yourselves in those annual reviews and allowing us then to really improve the quality of them and also improve our statutory timescales and our requirements of improving the quality of our plans. So the key data for us in thinking about things that are happening, annual reviews are that key priority for the SEN team moving forward. There has been an increased attendance, and we want to develop that further at the annual reviews by the LA officers. We're also looking at improving the educational setting arrangements around annual reviews in relation to timescales, and that includes when we do them, but also the time it takes us to review the paperwork and issue the next EHCP plan following an annual review. Because if there are changes, we want to do that in the statutory timescale of 12 weeks following the annual review, which allows us to be able to make sure provision is in place when the young person needs it. We also want to look at some improvements in amending plans following annual reviews. So this links in with our quality assurance and ensuring that we are still leading and driving our quality assurance of EHCPs. And we are looking to go live on what's called Envision 360, which is an electronic system that's going to allow us to really work as a multi-agency group in reviewing and quality assuring our plans as they go forward from annual reviews. We are developing a dashboard, so if the local authority, an electronic system again that will show the data live as it is happening in relation to developing monitoring of timelines and timescales for annual reviews. So this will be a really important tool in showing how Sendis is meeting those requirements, and also looking at how we are being able to improve that going forward. Increasing the management oversight of annual review processes. So we are being given as managers lots more data and information from the systems now, where we are working with the teams on a monthly and daily basis in a way of being able to ensure that the annual review process is at the heart of what we do. And we're also working with our youth participation workers and young people to redesign Part A of the information request form to ensure that the pupil's voice and young person's voice is heard in our EHCPs. And this is really something that we're driving from this term to be in place for next term, because actually we know that crucially we want to hear the views of our young people and what they feel about the provision, their education, and how they're accessing what they want their aspirations to be going forward. We just have a slide here showing the current team structure. As I say, there has been some slight changes in the team, so the names may change, but we have the 4 teams with the 4 managers. So you have Connor currently, who is our assessment manager, myself in primary, Vanessa in secondary team, and currently Susie Paris is in place in post 16, but we do have a new manager joining us hopefully at the end of July, who will be taking on the post 16 team. Susie will remain in Merton doing some key work for a period of time. And then we have Greg, who is our disputes resolution manager, working with Annalisa on our side of tribunals, complaints, MB inquiries, etc. So as the team stands, that's how we work together to ensure the delivery of the service. So our next steps and thinking about the future for Sendis into next term and where we're going, we're embedding the new annual review guidance across educational settings that involve training and working with our educational settings to look at what the LA will expect and how we can improve our systems. We're going to continue to monitor the impact of the dedicated resources to ensure compliance with our statutory timescales for reviews. Our timescales for our assessments have improved from 35% to 75% since 2020, and there's a commitment to improve that even more. So our commitment now with our team structure is to start meeting those statutory timescales to an even higher percentage. To continue to ensure that caseloads remain under the 140, 150 per EHCP coordinator, and this will allow us to continue that level of work around improving quality, improving timescales, and being able to work with you as families in a very proactive way rather than a reactive way. Guidance on the local offer and the role of the EHCP coordinators within that is also going ahead, and guidance on the local offer and the annual review process. So again, ensuring that when things are changing within Sendis, we'll put information out to families so that everybody is clear about what the expectation is. We're going to refresh the parent carers feedback forms. We've been hoping to do this for some time, but due to capacity and where priorities come in, this one has dropped slightly, but we are really coming back to that to make sure that's part again of how we get information from parents and carers. And so part of that is we are developing further surveys that will come out to families at key points during an assessment process or during an annual review process, so that we're able to pick up and get that feedback from you, which is so important to us about the work that we do and how we can improve our services. And as was said at the beginning, we want to know if there's concerns, we want to know if there's issues, but we also want to know sometimes if it's working for you and it's working well, because that allows us to then think about how we can develop those services. And also the release of the young person's feedback form, which will continue into September. Twilight sessions and thoughts and work in progress going forward, things that we're now starting to think about in a wider context, is possible things like meet the teams. We know it's really important that you know your coordinators, that you know who you're working with, you know the person, it's not just a name at the end of an email. So we're thinking about how we can do some meet the teams so parents get to know their case officers. Possible sessions from OT, SALT and EP around specific issues. We know that the therapeutic teams are under a great deal of pressure, as are in many local authorities across the country. But what we want to do is look at how we can gain access to our therapeutic teams that would work for families and be a proactive step going forward. And thinking about phase transfers process, so meetings for parents, carers. We started doing this around the secondary process over the last couple of years with Kids First, and we've had some really positive feedback. And we want to continue to develop that and look at that at other levels, at other phase transfer points, about how we share information, how we think about being, again, proactive in talking to families about processes.
Many thanks, Georgie.
Really nice to be invited to come and talk to all of you. So my name is Nick Flesher and I work within the Merton School Improvement Team, and I'm one of the school inspectors, and I have the remit for SEND. And as part of that role, I'm involved in leading on a project which is working with our schools, and we wanted to let you know a little bit about that and sort of how it connects into the big picture of what we're trying to achieve in Merton. So Elizabeth, thank you. So many of you will have heard of the phrase safety valve process and will be aware that Merton is one of a number of local authorities which is being supported by the DFE with regards to funding to support a deficit that we have around meeting needs of young people with SEN. This is something that's being looked at now nationally through the response to the government's Green Paper. We know that the system is underfunded and there have been some challenges around the setting up the provision that we would want to have in order to be able to meet needs. And so within the safety valve process, there are a number of conditions that the DFE have set for us as a local authority. And this school inclusion project is looking to support meeting some of those conditions. So I've put 3 of those up here. So condition 1 is about more children and young people remaining in mainstream settings where it is appropriate and where it is in their best interest. Then second condition is looking at strengthening the SEN support offer available to mainstream schools. So in the graduated approach that could end up with a young person having an education, health and care plan, there is a stage known as SEN support that I'm sure many of you are aware of. And what we're looking at is how can the provision and resources that support at that level, SEN support, how can we make that stronger and more effective? And then finally, ensuring that our professional networks across mainstream school settings are stronger, because we know that in Merton we have a number of schools who have a real strength around meeting the needs of children with SEND. And we want to make sure that those strengths, those best practices are shared out, and also to develop more best practice so that we can do more sharing out. So that's how this project is guided by those 3 conditions. Can we have the next slide, Elizabeth? Thank you. So the first phase of the project ran in this academic year from autumn through to spring. So this was the setup process. And as part of the safety valve process, we have some additional funding, which is allowing us to second special educational need coordinators from our mainstream schools to support project work in other schools. So the funding essentially allows us to buy and backfill so that there isn't a deficit for the school where the SENCO is stepping out. And the important thing is the schools that would be engaged in projects with the SEN advisors, the criteria that we used in the first phase for choosing those schools, and we're continuing to use this criteria, is that anyone participating in the project it's not an indication that the school's provision for SEND is weak. So if you have heard that your school is involved in this project, it isn't because someone has identified that the provision there is weak. It is about where schools, in the first few phases, we're targeting schools where there are high numbers of pupils who are identified with SEN relative to the school's deprivation. So you will be aware that some schools will have a large number of pupils with SEN, and the school itself, under the deprivation indicators, sits in an area of the borough where there is greater challenge around economics and general disadvantage. And we know statistically that that can lead to a school then having a large number of children with SEN. However, there are also schools that are in parts of the borough where deprivation levels are much lower, but there are still a high number of pupils of SEN for a whole range of different reasons. And some of those approaches in those two different contexts may need to be different sometimes, which is why we wanted to make sure that we included all schools in the project. Also, we are aware that a number of our schools in Merton are already undertaking a review of their SEND provision. They are recognising that they need to think differently, that they need to use their budgets differently, that they need to think about how they use additional adults, etc., etc. So we were interested to piggyback, if you like, onto that work, or at least so that we weren't a bolt on, but we could become part of something that the school had already identified and started to work on. So in that first phase, we invited 6 primary schools and 2 secondary schools to work with an SEN advisor. So in the first instance, the SEN advisors, we had one 3-day-a-week secondment from a primary school, one 5-day-a-week secondment from a secondary experienced SENCO, but who has recently been working within the SENDIS department, so brings with them that knowledge as well, which is very helpful. And then we were also able to second another primary school SENCO for 1 day a week, and then 3 what are called special leaders in education who come from our special schools. So our special schools of Cricket Green and Perseid are part of something called the Merton Special Training Alliance, where they provide outreach and support in a number of schools, both in borough and out of borough. So these 3 special leaders in education are very experienced at working in mainstream schools with teachers. The framework for the project began with a conversation with myself as the sort of project lead, work alongside the SEN advisor, meeting with the head teacher and the SENCO of the mainstream school. And we looked at something called the school inclusion profile. So as part of the safety valve process, Merton has commissioned the gathering together of SEND data that's available to the local authority to put it all into one place. So everything from types of needs through to financial spend, through to a crossover of needs. So there's all sorts of different ways in which this data is coming together. And we use that as a starting point for a conversation with the school alongside its own self-evaluation of where it sees its provision around SEND. From that meeting, and it was really important that we had that meeting and set out very clearly what the project expected of the school and what the school could expect from the project, so that everybody was working with the same expectation. Of course, you know, new projects, there's always a bit of teething problems that need to be ironed out, but from the outset, and one of the points we made was it was really important that senior leaders in the school were committed to inclusion and were committed to the project so that the SENCO, who would be the main person working with the SEN advisor, or other teaching staff, had the time and the opportunities to be part of project activities. Otherwise, it wasn't really likely to have the impact we wanted it to. The SEN advisor then worked with the SENCO of the school to create an action plan, and we tried to keep that very succinct, not to be over ambitious, to identify some key target areas where we might look at how we could strengthen the SEN support offer within the school. And we set some clear success criteria so that we had something to measure against once the time for the project to finish came to fruition. Thanks, Elizabeth. So we had a number of different projects running, and we had agreed with the school that there would be an SEN advisor input for one day a week, and that would run for between a term to a term and a half. So there was quite a significant amount of additional support going into the school. In the summer term, where we are now, we have continued with some of those phase 1 schools where we've just needed to finish up projects, and some have asked to have a sort of keeping in touch process where they can have reduced input from the SEN advisor, but keep checking in on what it is that they've been doing. And then we've taken on some more schools. So we've got 3 primary schools and 1 secondary school, and we were also able to second another SENCO for a day a week to be a part of the support team. Challenges that have kind of come through in the autumn, spring and the start of the summer term is it has been quite difficult for us to recruit and second SENCOs from schools. You, I'm sure, are aware that there's a whole national agenda looking at the reform of what happens for pupils with SEND, and that is likely to, well, we know it is likely to bring around some quite significant changes. And understandably, school leaders do not want to let their SENCO go during a time of change. So we've had to sort of work very creatively with schools to have sort of bits of secondment time and think slightly differently about how to do that. So that's been a little bit of a challenge. Inevitably, we came out of winter at the beginning of the spring term, and there were staff with COVID, there were SEN advisors with COVID, there were other illnesses that were happening, and that did put a little bit of a slow start to that sort of period of time, but we've started to catch up now, which is great. And then, whilst we've tried to be very creative about the number of, or the way in which we second SENCOs to the project, it has meant that we've got quite a lot of people working on the project, whereas we were really expecting initially to have 3 full-time people. And that can come with some challenges around organising and getting people into the right places at the right time. So we've all had to be sort of quite creative and methodical about how we do that. Thank you, Elizabeth. So as we go into the autumn term, we will, as we did with phase 1 schools, we'll continue with phase 2 schools, but with a little bit of reduced input and a real emphasis then 1 year on into sharing the learning and the resources and the best practice that were created in the project through phase 1 and phase 2. Some of that's already started happening, and that will also include visits to schools that have been part of the project. So this is all part of that networking and building and sharing of good practice. We'll be taking on an additional 6 to 7 primary schools and a secondary school. And we will be interviewing now for an external candidate for the full-time position of another SEN advisor. So we're very much hoping to be able to build up our SEN advisor team. We'll continue to look at measuring achievement against the success criteria in each project, and we want to ensure that there is at least one clear aspect of the project which has had significant impact, so that we know that every school involved comes away with something that has improved the provision for pupils with SEN support. We also want to begin to identify where the schools involved in the project where that graduated approach is leading into a reduction in the need for EHCPs where appropriate. So by that I mean where historically an EHCP has been applied for in order to access certain provision, because that was the only route to get that provision. We are hoping that with the work that we're doing to create that provision within mainstream schools, that there won't be the need to apply for the EHCP for those particular pupils. Obviously, there are others where high needs mean that they do need an EHCP, and that will obviously continue to happen. And we're also interested to look at, as part of our impact measure, how schools are using what we call the buyback support. So schools, as you will know, the current system provides within a school's budget what's known as a notional figure for SEN. So it's based on the context of the school and the number of children with additional challenges. So that could be those with disadvantage, etc., not necessarily specifically SEN, but it then means that if you look at a statistical model for the whole country, you can say, well, if you've got that set of context information, then the chances are you're likely to have this level of pupils with SEN in your school, and then the funding is provided accordingly. And so schools use that funding to buy in additional support. A lot of the time, that has been about getting assessments to support an application for an EHC. And what we're looking at is through the project, are we able to diversify a little bit how schools are using that money, so that some of that might be about using speech and language therapists to provide professional development for teachers, so that teachers are in a better position to deliver to some of those needs. Again, where appropriate and where it is possible to meet those needs within the classroom. Okay. Finally, then, just to link into some of the sort of bigger picture of what's happening with SEN. So I mentioned that this project draws on our school inclusion profile. So that's our data package that we now have to look at SEN and to help us understand that more clearly. It's NASEN, National Association of SEN, has produced a teacher handbook called Embedding Inclusive Practice. It's a key tool that we're working with, and Perseid, our special school, was one of the contributors to that. We are, as you will have heard, producing the Merton's Ordinarily Available Guidance. So this is to try and help school to have equity of resources and provision across our schools in Merton. That will take time to build, but that is something that we're been working on with schools to try and unpick and see what it is that they need. And the project has provided a growing platform for schools to let us know about some of the challenges they're experiencing, particularly in the context of where we are now after a pandemic and post-lockdown. So, for example, we know that there are a number of children in early years who have missed some of the provision they might have had we not had lockdowns and a pandemic, and therefore they are coming to school with initially some significant needs, and then hearing from schools around how that is being managed and what they need, as the project has provided a good platform for being able to do that. Okay. That's me done. Thank you, Elizabeth.
Thank you very much, Nick. And we were going to go straight on and do the short breaks bit. Alison, I think, as we've worked out, things are quite busy here this morning, so I'm not sure if Alison's able to come in straight away. So what I'm going to do is just go quickly. I'll come back to the short breaks in a moment in the hope that Alison will be able to join us then. And I will do my bit, which was going to be the last bit of presentation today. I said we'll come back to the short breaks, but our SEND strategy. So you may well have heard us talk about the SEND strategy, our SEND strategy, which has been going since 2019. So it's our local area SEND strategy. You could see the key partners that we've got involved in our local area SEND strategy. Kids first, front and centre there. The local authority is the final of those icons, but also importantly our Safeguarding Children's Partnership and also NHS Merton. That's the old logo for the CCG, because of course it's now the ICB. So we've had a SEND strategy since between 2019 and 2023, and we are now refreshing. We've spent some time, or we are in the middle of, I should say, consulting with various different experts and professionals, and I'll talk a little bit more about that in a moment. So just a little bit of context. As I said, we've had our SEND strategy, well actually 2020 to 2023. We are creating some data, which is what that joint strategic needs assessment means. So we're pulling together all the key data that we have around our children and their families who have special educational needs and disabilities, and looking at that data, that outcome data, whether they're being supported and enabled to achieve their ambitions. So outcome data around education, around health, and lots of others as well. And that will help to inform our strategy going forward. Nick referred to our safety valve programme. So that agreement, or that programme with the DFE, the Department for Education, runs between 2022 and 2027. So you'll have seen 3 of the conditions that Nick referred to, which are fundamentally around increasing the capacity and expertise within our schools. And we've got other conditions as well. We've got to build those into our new strategy going forwards. The other thing that we're very mindful of in terms of what's happening for us locally is, like all other local areas, we are inspected and visited by Ofsted and the CQC, the Care Quality Commission, from the health aspect. They come and look at all local areas on a regular basis. And we had our last visit back in October 2022, which was a successful outcome. But still on our journey of improvement. They left us with some other things to think about. So all of those 4 things on the left-hand side is our local context, and we want to build that into our strategy. On the right-hand side are the national contexts that also we need to consider as we are developing our strategy. So again, maybe you have heard around the government's Special Educational Needs and Disabilities and Alternative Provision Improvement Plan. So that was published back in just a couple of months ago. It's got a very snappy acronym. It's called the SENDAP. You can see SEND and Alternative Provision, Improvement Plan, SENDAP Improvement Plan. And that shows the national direction of travel from the government. And that's helpful to us in terms of helping us think how we can, again, continue to improve. And then the other national point that we need to think about is that there is a new inspection framework. So I refer to the fact that on the left-hand side, we were visited by Ofsted and CQC in October. They have created a new inspection framework, so new criteria against which we will be inspected going forward. And again, we want to be mindful of that. So lots of things, quite apart from the really important input from experts, professionals and stakeholders to what the direction of travel for our strategy from this year onwards. This slide just shows you the process that we're going through, and because we're taking that full year, or almost that full year, you can see how we are wanting to get this right. So we are in the on the grey lozenge at the moment, the second one along. So we are in the middle of the engagement process through workshops with key stakeholders. We've met, there have been 2 sessions with parents and carers, and it was great to see so many people there, both in person for one of them and then online for the other. We are also obviously listening and asking questions and listening to our children and young people. Our participation service in the local authority is helping us with that. And we're wanting to make sure that we hear from children and young people and thinking about the accessibility of the questions that we're asking. So fundamentally, we are physically going to the young people. We're not just expecting them to come to us, but we're also thinking about the way we ask the questions so that children with SEND, so with their special educational needs and disabilities, are able to contribute, whatever the level of those needs. We're going to SENCOs, we're going to head teachers, and we're going to the broader multi-agency professional group, so across health, education and social care. Across that summer period, July to September, we're going to pull things together, some of those key themes, and we'll create an initial draft. And then we're going to need to come back in October and November to the people that we're consulting with at the moment to say, okay, this is what we've heard from you, and this is how we've tried to pull it all together so that we can really focus on the key things that matter within the next 3 years or so. And then we're aiming for a sign off with our senior SEND strategy governance board in November or December. And then we'd like to have a SEND conference in January and February. And my personal wish is that SEND conference is face-to-face. It's a large event. It involves parents, carers, young people, professionals, schools. And so I'm even thinking, if you know the Chaucer's not going to be big enough in the size of my ambition. We're going to have to look for somewhere bigger. And our next couple of slides, just bringing in some of the feedback from workshops so far. So when we have been engaging so far with parents, carers and the wider professional group so far, we asked them to think what we must do, what we should do and what we could do. So the must absolutely is in relation to statutory, the really urgent stuff. The should is the next stage up, and then the could, the blue sky thinking. And we've got 7 clear themes which are coming through so far. Firstly, around communication. That's communication with parents, carers, children, young people, and making sure that that is as strong as it possibly can be, so that we as professionals, let's pick up on that in particular, are listening really hard, but also making sure that there is a clarity of our communication back to parents, carers and children and young people. There is a theme around provision and making sure that that provision is as inclusive as it possibly can be. And I'm really pleased to hear that in terms of, you know, obviously, because what we want is that provision, whether it's education or whether it's therapy, it does meet the needs of children and young people. Equality and inclusivity, the voice of the child and the family, keeping that absolutely at the heart. So obviously we're doing a really big piece of work as part of the SEND strategy refresh to make sure that we keep that voice at the heart, but we've got to keep that going. And I'm just going to mention something in a slight tangent here. But one of the things, I'm very grateful for the input of Kids First colleagues who've been working with us, well, for a number of years now. One of the things that we are thinking is how we can take the theme of co-production, which is something that we have to do as part of the SENS Code of Practice, but you know, how do we make that really work so it's not tokenistic, really wanting to take that to the next level. And so we'll do some thinking with Kids First within, you know, we're creating a strategy, but we're thinking already about how we can make that co-production really stronger. Partnership working and thinking family, so thinking about and you know, how all the services can come together to support a family. Training for the workforce, seen as absolutely important, and timeliness, yes, which of course you as parents and carers have commented on already within this meeting. So what's next? So as I said, we're in the middle of that engagement process. And we've got more, so it's more engagement with children and young people. We've got our SENCOs workshops on the 5th and 12th of July. We've got strategic meetings with head teachers over the next couple of weeks as well, as we continue to build on those themes. That was my last slide. I'm just going to see if Alison has been able to join us. No, she hasn't. So I am going to go backwards and forgive me, you've got me presenting slides which I am not entirely inside. But I will do my best. And if we have any other questions that I'm unable to comment on or respond to, I'll ask Alison to come back to us.
Elizabeth, so, sorry to
yes.
interrupt. Would it be all right if I took some questions now? I have to go in 9 minutes, so I'm just conscious I don't want to, or if you prefer, you could take questions and I can happily answer those by email.
Yes, Nick, let's do the latter. Maybe I can pick up on some things, but if there are some things that I'm unable to answer, I'll refer to you and we'll get some responses back later. But
Thank you very much. Nick. Sorry not to be more flexible. Thanks.
Thanks, Nick. Okay, so short breaks. Setting out on this slide, what is the statutory legislation for short breaks for children, young people and their families? So you can see we've got two key pieces of legislation. The Short Breaks Duty Regulations 2011 requires us to provide a range of short breaks to give disabled children the same opportunities to play and socialise that other children experience, whilst allowing their parents to provide care more effectively as a result of having that break, so that respite. And the duty is to provide a range of services so far as is reasonably practicable. The second piece of legislation is in relation to the 1989 Act, where it says that a key purpose of short breaks is to give families a break from caring. Yes. So when does the law require a local authority to provide a family with short breaks? And it says, in terms of those 2 points, when the local authority decides, following an assessment of the child, taking into account any parent carer needs assessment, that it is necessary to provide short breaks at home or in the community to meet the child's needs. And when a family are in actual crisis, which I feel is obviously, the idea of waiting for that crisis to happen, that for many will be too late. So we, as you may know, are conducting a short breaks review. And this is some initial findings from our review. We're in the process of doing this, and our next steps is that we need to ensure that we get that input from parents and carers. So the last time I came to see you, I talked about doing some initial internal work, which is what we've done, and now we need to make sure there's, again, it's still an early stage, involve parents and carers input through Kids First. So Public Health is preparing that joint strategic needs assessment. Now, I refer to this in terms of our SEND strategy, but as a really key set of data. But the data will help us to identify any emerging trend data on children with disabilities and what kind of conditions are most prevalent, and where we can project our understanding of what will need a particular focus in the future. We are going to be carrying out further research with providers to establish levels of provision and capacity across the borough. So, as you will know, there will be some things that we provide directly, for example, Brightwell. Some of you will know Brightwell as some of the provision for short breaks. We commission some of the other bits of short breaks. So MenCap, we commission MenCap to provide some short break provision, which is out of Perseid Upper School. And then there are other providers who are not commissioned. They are private or voluntary, but they are also providing services. And sometimes we're able to, through a short breaks package, enable parents and children to access those. We are going to be surveying parents and families that currently access short break services, to get feedback on what you think, what they think around the current provision is, and positive, negatives, where the gaps are. We are obviously going to need to be talking to discuss things with adult social care, because when a child or young person turns 18, they're obviously still working. We're still supporting them through SEND, but then sometimes they will meet the thresholds for being supported by adult social care. Sometimes it's not about meeting adult social care thresholds, it's about thinking about the wider services that are available post 18. We need to look at our web pages to review those and update those, and also to think about the presentation of them so they are most accessible. We are needing to look really carefully at the budget setting across all our services, our direct provider provision, are commissioned, and also other so the wide range of budgets, so that we can actually think really clearly how we can configure those budgets. And we found this, so Wandsworth Council use Formulate, which is a package which calculates personal budgets and direct payments. And we're wanting to have a look at that in more depth to see if that's something that could be useful to us in Merton. So going on with key draft initial findings, so our key conclusion is that we need that closer dialogue and coordination of resources, because we've got some short breaks being provided or decided on within our children with disability services, so that's CWD, and then we've got a separate service which sits elsewhere in children, lifelong learning and families, which is our short break service, with and we need those services to be working better together, and that will enable us to get better oversight of the children across the two services. We can get those budgets better aligned and better knowledge and intelligence to shape things going forwards. And will also help us to resolve some operational issues that we've recognised, and thinking about the decision making about the use of our resources. And then finally, so just thinking about our next steps, further analysis on the current offer to families, improved understanding of cost, going to be looking at eligibility and criteria to make sure that we are reaching those children that we need to support. We need to think about a sufficiency assessment. So in terms of that community-based provision, as I said, not necessarily the ones that we provide or commission, but are there in the wider community enough resources out there? And most importantly, and I would like to put this on first, the co-production and getting parents and carers involved at this early stage. So